mucha informalidad, ¿no? El doctor Francisco Becerra es un, ¿cómo es que se dice Francisco? ¿Deputy qué? Assistant Director, past Assistant Director of the General Secretary of PAHO, Pan American Health Association. Organization. Sorry about that. So, Francisco, let me tell you, the greatest friend, let me show you why he's here. Because if we need to make changes, the first thing after acknowledge there's something to change is find the tools. And the health systems are in the middle of everything because, you know, we can save one person, we can do that, but if we don't have the governments, the health system to help, we will never do it. So he is an expert in health systems. Dr. Francisco Becerra, MD from the National Autonomous University of Mexico, MPH from Johns Hopkins School of Public Health, and PH from Mexico's National Institute of Public Health. Dr. Becerra is the former Assistant Director of the Pan American Health Organization, World Health Organization, for 5 years, ending in 2018. He is visiting professor of global health at the Global Health Department, Global Health Consortium of the Roberts Temple College of Public Health and Social Work at the Florida International University. His interests have been centered on health systems use of evidence for decision-making and the strengthening of health research systems. Querido Francisco, mi wichiwachi English, pero ahora te lo digo en español. Te quiero.
Muchas gracias, Ingrid. Gracias por la invitación. De hecho, fue 2015, en esa visita que hizo a Estados Unidos, en que terminó en mi oficina y estuvimos platicando un buen rato. Desde el punto de vista de anécdota, fue un parteaguas porque eso dio el inicio a una serie de colaboraciones con la OPS, en que pudimos tener un número especial de la revista sobre salud masculina. So it was the very first special number of the Pan American Health Organization Journal on men's health. It was in 2016, probably, and it's like the old club of cronies that we are meeting here again. Those who were here at the very first meeting, now we are once here again. Thank you, Ingrid. And so I don't have any conflict of interest to declare. And this is what I'm going to be talking about, the nationalistic vision, local decisions, global affectations, in investment in research and politics, conflicts, global conflicts, risks, and aging. So in global health, we say think globally, act locally. But local decisions have global affectations. And this is something that we are seeing. And you have seen here the decisions in the internal USA around HHS, FDA, CDC, NIH, and the ACIP, the vaccine committee, that vaccines have to be optional, which is stated at the New York Times in January. It's a consequence of what's happening worldwide as well. This is having repercussions all over the world. And you can see that measles cases in the United States started with outbreak in Texas that moved to New Mexico, expanded in the U.S., but then it came to Mexico in the northern border to Chihuahua with the Mennonites, the same group as in Texas. And now the U.S. has close to 3,000 cases. They have an outbreak in South Carolina, but in Mexico we have close to 8,000 cases. And now we have measles all over the place in the Americas. And there's a lot of measles as well in Europe. Europe is not the best in keeping track of measles coverage, but now we have many countries that are losing their status of elimination. We also have this American first vision that first me, and then that's had all these kind of repercussions. We have a vision of security from Russia, which is the world against me, and that shifts the whole thing and what's happening in Ukraine and what's happening somewhere else. Then we have all these issues, and focusing only in one region or one country, it has opened the doors to China expansionism. So we have seen how China has been more and more invested in Africa and now Latin America as well. So you can see in red in the map how many advantages has China taken from those spaces that the United States has not taken consideration to Latin America, for instance, or Africa. So that opens a lot of opportunities for China to invest. And let me tell you, I've been visiting several countries, and I was in Africa, and I saw how China was investing. But of course, it's not free investment. They always take something back, and they take something big. So, and then we have Latin America, which is totally united. I mean, every country is running on their own. It's the leftist governments, the right governments, and each one doing whatever they want. And now Latin America was very united. And recently, 7 countries decided to leave one of the main regional forces, and now everybody is doing whatever they want. So this also has repercussions in health and has repercussions in a lot of things. We are seeing now that the United States decisions and in multilateralism is taking a toll. This is a picture when the WHO in Geneva was taking down the flag of the United States because the United States was leaving the World Health Organization. So the moment the US is leaving the World Health Organization, it's going to have repercussions in many ways. Why? Because CDC was keeping track of a lot of outbreaks around the world. That was really supporting in being able for the world to stop and detect early outbreaks of any kind of disease. What's going to happen now? We don't know. This is going to be a very, very profound problem in the future, because that means that the newly accepted pandemic treaty, the United States is not going to be there. And it's happening the same repercussions within the Pan American Health Organization. The United States was, during the opening of the last directing council, the US representative made his speech, and after he finished his speech, the whole US delegation left the room, and they did not participate in the directing council. So that is a direct message to PAHO that the US is not interested in taking part in the Pan American Health Organization. That will have some repercussions in Latin America as well, because it will affect with around 50% of the budget for the Pan American Health Organization. Then you have in the map there Argentina, who's going to be leaving the World Health Organization sometime during this year, following the example of the United States. So these kind of repercussions, you're going to be seeing more and more and more. Then we have all these things around the Pacific and the Caribbean attacking these narco attacks. And then you have this clinical trial on hepatitis B, which was suspended in Guinea-Bissau because it has some interest from the US. And they review it and they said, no, this cannot go. It is not ethically possible to do it. And then you have this Board of Peace, which is a conception of try to do something, but with a upfront payment to someone's pocket. And then we have all this institutionalized the funding worldwide. So United States is leaving around 66 organizations, treaties, and conventions, international conventions as of this year. That will have immense repercussions in health and in other sectors. Some of the affected organizations is WHO, PAHO, UNFPA, UN Women, etc. When USAID disappeared, it had a tremendous impact and is causing vulnerability in all around the world. So when I was preparing this talk, it was in January, at noon, they already had been detected 248,000 deaths in adults and over 500,000 deaths in children. It's an estimated 88 deaths per death since USAID was defunded. That is the kind of repercussions that a local decision is having around the world. One example, and let me start by 10 years ago, a little bit more than 10 years ago, because the first meeting was in December and we are in January, so it's about a little bit 10 years ago. I started my talk at that time stating that the Americas was very proud on all the achievements we have had in public health. And we just had reached the elimination of rubella status in the Americas. So let me tell you that probably those are days long gone. Now we have a very good example around measles that I was talking about earlier. And so just last month, WHO announced that 6 countries in Europe had already lost their elimination status on measles. Armenia, Austria, Azerbaijan, I can pronounce Azerbaijan, Spain, United Kingdom, and Uzbekistan. Canada already lost the elimination status at the end of the year. And in April, most probably United States and Mexico will lose their elimination status. So this is issues around vaccination is not only the decision-making of what's happening with HHS and all those things, but this is also kind of a collective amnesia that younger generations don't understand the value of vaccinations and immunizations because they never had to see this kind of diseases. In our generation, many of the old pals were here, many of us did have measles, but we were living in such conditions that we didn't have any complications at all. But now, the younger generations that did not have and suffer this kind of diseases, they don't have this knowledge of what's happening with this kind of problems that you can eliminate with immunizations. So you have a global instability, you have an ecosystem of online information, which is totally changed, and all this rapid knowledge that goes through TikTok or whatever, and all this lies that are going there, the loss of confidence in the institutions, bad administrative decisions and bad planning in the health systems, the fragility of health systems, which is a reality, and we lived it through COVID. It was nothing else but fragility of the health systems. And as I said, US and Mexico will probably lose their elimination status by April. But this is a case of measles from Chihuahua. Dr. Moises Ramirez Lopez lent me the picture from a Mennonite young boy that was sick, and there was a lot of cases in his area in Chihuahua. But at the same time, we have this promotion for measles vaccination from the government of Mexico City last February 4th, that I took it on the street where I was driving, and it says, vaccinate yourself against measles. But what's the use of making all this promotion when you get to the health center and there's no vaccine, or there's not enough vaccine for all the children and all the families that are demanding it? So that's a problem of bad planning and bad decision making. When we talk about investment in research for health, We can see that in North America and now the United States, with the impact of NIH research funding, is really, really bad. But we also seen it in Mexico, because the last government with López Obrador, we have seen it in South America, and we see the difference in Europe, when Europe is investing more and more through the Horizon with over close to 500 million euros. Africa is, some countries are investing in research. Asia, China has a plan to increment the investment 3 or 4 folds. And Australia and New Zealand, they're doing their own marching, and they're doing very well. But this is the big difference that we have worldwide in terms of investment in research. And we're going to be seeing new countries emerging with new investment and probably new leadership in research. At the same time, we have a lot of active global conflicts in war zones, in violence, and all those little dots that you see, there is a conflict, an ongoing conflict. So this is something that we have to understand, that when you don't have the social growth, the economic growth, you will have conflicts. When you don't have political stability, you will have conflicts. And all these things have health repercussions as well. So we have to understand that everything is interlinked. Everything is linked to decision-making, and everything is linked to politics and probably fanatism. Then we have climate change. We will not discuss all the things around climate change. If we know it's true, we know it's something that is happening. We can see the map there, how the countries contribute with the CO2 in the world. We can see how the CO2 is growing mainly in some areas than others. Agriculture is one of the participates with about 21% of CO2. And then we have climate risks, and you can see the map there. You can see all the red in that map, how the climatic risks are there and they're important. Then we can see with this kind of new mapping system, which is incredible, the emissions by region, and you can see how Asia and North America and a little bit of Europe is really participating with the emissions by region. They're really contributing to that. But also how many people are in risk. And you can see that the area with the higher risk is Asia, and then Africa, and then poverty. And poverty, once again, Africa and Asia. So you can see with the main region with emissions of CO2 is also where you have more people in risk and more people in poverty. So everything is linked. Then we have growing populations. And this is the first time in around 220 that we are more elderly over 65 than children under 5. So that means that in the future, we're going to have a serious problem for those who are going to try to get a pension or who's going to be supporting the whole system when populations are decreasing. And but also you see how which countries are living the longest, and you can see there that Europe and those countries in yellow, orange live the longest. So there's going to be some problems in those countries. And Latin America is getting older and older at a faster rate than Europe after World War II. So this is important because you can see that in this risk of Latin America, we are focusing the same risks, but we don't have enough geriatric system, geriatric specialists, gerontologists to take care of the elderly. In Mexico, there are not even 2,000 geriatrists right now in Mexico. And we are 130 million people country. So this is risks in the health systems that are not prepared to take care of the elderly that are coming. Then we have cancer, and you can see male cancer is going to be the highest. It has the highest incidence than women, and as well as mortality. Of course, breast cancer and prostate cancer go very close. Then you have colon, a little bit higher than breast. So you can see that cancer in males, as Marian was talking about, is really impacting our populations. So you can see the same with other cancers, and you can see how cancer is behaving and is going to be behaving in the future in the world. But not everything is so bad. We have very beautiful things. This is a project Euclid from the European Agency. And you can see the universe there, but you can see those yellow little things in the map, that those are the areas that they're investigating. And all those little things there that you can see there, all those are different type of galaxies in the world. So we are nothing compared to the universe. And still, we don't understand our place in the world, our place in the universe, and we're still scrambling and trying to learn how to walk and making bad decisions in this world. So thank you so much.